Material in this video contains content included in the RBT Test Content Outline, 3rd edition, TCO. B.2. Participate in assessments of relevant skill strengths and deficits. James, an RBT, was assigned to work with Marcus, a 10-year-old boy who struggled with social interactions and completing daily routines. To begin, James and the supervising BCBA prepared a curriculum-based assessment to evaluate Marcus's academic and functional skills, along with taking observational data of his skill levels with various social interactions. James reviewed the BCBA's instructions, focusing on collecting data on Marcus's turn-taking abilities and self-help skills. He gathered materials, including a board game to assess turn-taking and a task list for brushing teeth, ensuring all data sheets and timers were ready. During the curriculum-based assessment, James presented Marcus with a set of simple tasks aligned with his educational goals, such as identifying colors and completing a short puzzle. James documented Marcus's correct and incorrect responses, noting his need for additional time to complete the puzzle. Next, James observed Marcus playing a board game to evaluate his turn-taking skills. Without prompts, Marcus repeatedly tried to skip the other player's turn, saying, "I want to go again." James recorded the frequency of successful turn-taking interactions, as well as the duration of time Marcus was able to wait patiently for his turn. At the end of the session, James summarized the data. He noted Marcus's strong ability to recognize colors, but a skill deficit in waiting for his turn during the board game. This summary guided the BCBA in creating Marcus's intervention plan, ensuring the new goals set would target his specific needs, such as increasing his turn-taking skills. By addressing these deficits, the intervention plan aimed to gradually build Marcus's inhibition and social skills in meaningful, measurable ways. Skill-based assessments evaluate a client's strengths and deficits in various areas, such as communication, social interactions, and daily living skills. These assessments provide a clear picture of what skills the individual has already mastered and where support is needed. This information is essential for designing interventions that are tailored to the individual's needs. Assessing skills is crucial for creating personalized intervention plans. By identifying specific deficits, the BCBA can set measurable goals to help individuals make progress in targeted areas. For example, if a child struggles with waiting their turn, the intervention plan can include activities to practice inhibition and teach turn-taking skills. Skill-based assessments include curriculum-based, developmental, and social skills assessments. Curriculum-based assessments, like the vb-mapp, cover a wide range of domains such as language, imitation, and play skills. Developmental assessments focus on milestones for age-appropriate growth, while social skills assessments evaluate a range of social interactions and social communication skills. RBTs assist the BCBA in implementing skill-based assessments by preparing materials, collecting data, and observing behavior. They follow specific instructions to ensure the assessment is conducted accurately and professionally. Their observations and data collection are essential for creating intervention plans tailored to the client's needs. RBTs work closely with supervisors to ensure assessments are effective and ethical. They maintain professionalism by following guidelines, documenting observations objectively, and respecting client confidentiality. This collaboration helps ensure accurate results that inform meaningful intervention plans. Summarizing collected data involves organizing raw observations into clear and usable categories, such as strengths and deficits. This helps highlight key patterns, making it easier to understand the client's current abilities and areas for growth. For example, data on developmental milestones might show that a client excels in fine motor skills but struggles with receptive language tasks. It's essential to review and verify data with the supervising BCBA to ensure accuracy and clarity. This collaboration helps confirm that summaries reflect the client's performance and align with assessment goals. Presenting data in clear formats, such as charts or graphs, can make it easier for supervisors to interpret and use the information effectively. When sharing data summaries with the team, RBTs should maintain confidentiality and professionalism. This includes avoiding subjective opinions and focusing on factual observations. For example, when reporting findings in a meeting, the RBT might say, "The client completed 80% of the hand-washing task independently," instead of making personal judgments about the client's progress.
Key takeaways for RBTs when assisting with skill-based assessments. Prepare thoroughly. Start by understanding the purpose and goals of the skill-based assessment as outlined by the BCBA. Gather necessary materials like data sheets, timers, and visual aids, and ensure the environment is free from distractions. A well-prepared setup helps create accurate opportunities to observe and document client skills. Collect data accurately. Focus on recording observable, measurable behaviors during assessments. Use tools like checklists to categorize skills as mastered, emerging, or non-mastered. Collecting accurate data ensures the BCBA can make informed decisions about the client's strengths and areas for growth. Observe role-play scenarios. Use role-play as a controlled way to observe client responses in realistic situations such as social interactions or daily routines. Document specific behaviors like whether the client waits their turn or starts communication. These observations provide insight into the client's skills without introducing teaching strategies during the assessment. Summarize and share findings. Organize raw data into clear summaries, highlighting both strengths and deficits in skill areas. Collaborate with the BCBA to verify data accuracy and present findings in easy-to-understand formats, such as charts or graphs. Sharing concise, factual summaries helps the team set client-individualized goals and develop effective intervention plans tailored to the client's needs. RBTs are an important part of skill-based assessments, helping to gather the information needed for successful intervention plans. By preparing for assessments, collecting accurate data, observing client behavior in realistic situations, and organizing clear summaries, RBTs help identify a client's strengths and areas for improvement. Their work allows BCBAs to create plans that match the client's individual needs and help them grow in key areas. Teamwork between RBTs and BCBAs makes a real difference, giving clients the chance to build new skills and improve their lives. The dedication of RBTs in this process is both valuable and deeply appreciated.